of the brain inefficiencies. Now, bipolar, the typical classical notion of bipolar is you're either in a pit or you're on a mountain, and there's no in between. Okay.
That's the classic. That's right. Top of, up and top or down the bottom.
Now, what these people often have is a major marker for predisposition to depressed mood states, a major marker for emotional volatility and mood dysregulation, and a major marker for severely poor stress tolerance, predisposition to anxiety. Okay? So, it depends on which one of these things is activated.
At that particular moment as to what they do. Okay.
In terms of what they do. So, how do they control this? Well, they give you something to keep you down, and they give you something to keep you up. And then they give you something to mood modulate you. And then you can't sleep, so they give you something to sleep. Okay. So these folks, the problem is they come in and they say, I really don't like to be on drugs. And when you hear somebody say that, you would assume, well, you're not on any drugs. You don't like to be on them.
But they're on 4 different kinds.
The fact of it is, they are maxed out on 5 or 6 different medications. They're frightened. Nothing is, they're at the end of the rope in terms of trying to medicate this. They're afraid to come off because they don't know where they're going to land. They're going to have another problem in terms of in addition to the bipolar, they're going to be addicted to something. And I mean in the sense of what it's going to take to come off all this stuff. Their brain is going to be sluggish in terms of our trying to do neurotherapy with it because it's heavily sedated and heavily medicated. So they're a mess. Now, is the diagnosis of bipolar going to help us at all? It's not going to tell me one thing about what I should do. And that's what I really have against the use of labels. Does it have any therapeutic significance?
Not likely.
And the answer is zero.
Because you're going to take a look and say that there's 5 people with bipolar, and this one's got something wrong more there, and this one's got something wrong there, and they all have to be treated differently.
Yes. And ADD is one of the best examples.
Well, you've got, 13 or 14 different definitions of ADD? Or
different
degrees?
Patterns. That's right.
Different patterns.
So you have some that's associated with elevated slow frequency over the sensory motor cortex. They happen to respond to Ritalin, methylphenidate. You have others that have elevated alpha frequency in the front part of the brain. These are the highly chatty people who will remain anonymous at this point. You give them Ritalin and they really are in trouble.
Yeah. Okay.
Unless you give them heavy sedating doses of it, etc. So the label of ADD told us nothing about what we should do. Zero.
And
there's a huge industry associated with giving labels.
Oh, tell me about it. I've taken 2 psychologists who specialize in ADD down to your clinic. Because I thought, boy, they'd look at this and they'd say, wonderful. And neither of them continued or even attempted to because it's too hard to give up patients. Their practice was, and I'm not knocking them, they're good people, but their practice is helping the family deal with the child with the ADD. It's not getting rid of the ADD.
Not treating the ADD, right.
It's keeping them there forever. Okay, does that sort of answer the question for you, Ellen? And that does. And anything that I missed, Paul, that you want to put out before we sign this one off and get on to another week? Oh, what are we going to talk about next week, too? Next week we're going to talk about oppositional behavior, conduct disorders, adoption issues, and depression. That depression comes up all the time, doesn't it? Okay, so if you've got an adoption issue or oppositional behavior.
Oppositional defiance disorder.
Oppositional defiance. Okay, I got that. So that's something like between men and women, right? Conduct disorders and adoption issues. We all think we got adopted at one time in our life. Dr. Paul Swingle's been my guest. You can find him at www.swingleandassociates.com. He's the author of this wonderful book, Biofeedback for the Brain, which is made for the layman and the person. You can get hold of it by logging on to his site. You can get an appointment with him at his office, 608-0444, and put a 604 in front of it for the area code. And if you do, tell him you happen to watch this show or something or other, and let him know that you were watching. Thank you, and thank you, Paul, and thanks for watching, and thank you, Mitchell, for filling in for Richard Pitt, who had to take off and go to some sort of wedding ceremony.